Hi, I'm Dr. Adam Gattay from The Ohio State University. We're here with the CLL Society to discuss exciting abstracts from the American Society of Hematology 2023 conference. Today, I have with me Dr. Boyu Hu from the University of Utah. Why don't you go ahead and introduce yourself?
Yeah, thanks so much for having me today to the CLL Society, Dr. Katai. My name is Boyu Hu. I'm an assistant professor here at the University of Utah and also the director of lymphoma CLL. I'm a lymphoma and CLL provider and a clinical trialist, and I'm really excited to talk to you guys about my investigator-initiated trial today.
Yeah, so we have Dr. Hu on to discuss the phase 1b/2 trial of the combination of RP-3500 and olaparib in DNA damage repair pathway deficient relapsed refractory chronic lymphocytic leukemia. He is the primary investigator on this trial, and this is an early phase trial with two drugs that haven't been combined yet for the treatment of CLL, but have been combined for other cancers. So I'm excited to hear what Dr. Hu's thoughts are on this trial, why he had developed this trial, and why he thinks it might work in CLL. So Dr. Hu, why don't you go ahead and take it from here and tell us a little bit about this trial, what the rationale behind this trial is, and why you think this might work for patients with CLL.
Yeah, absolutely. Early in my career, I really saw this unmet need in patients who are high risk in CLL. And as we know, patients with deletion 17p and deletion 11q, p53 mutation, and ATM mutations are all incredibly high risk. And we say that because these patients, while they have some response to chemoimmunotherapy, they typically are more resistant and relapse faster. And even in the era of targeted agents, including ibrutinib, acalabrutinib, zanubrutinib, and venetoclax, we see better responses from these high-risk patients to these targeted agents, but inevitably these patients will relapse usually sooner than patients without these high-risk features. And so if you actually look at what these genetic changes are doing to the cell, they're affecting the DNA damage response. So at least ATM is the primary protein that's responsible for double-stranded DNA repair. And without it, these cells can go through a lot of different DNA changes that give it a growth advantage. Now, usually in normal cells, if there's too much DNA damage, p53 is activated to essentially tell the cell to die off. But because that signal is also missing in some of these cells, these leukemia cells, CLL cells, they survive essentially forever. And so in solid tumors, there actually has already been exploration of targeting alternative mechanisms of DNA damage response. So even though these main mechanisms are gone in CLL, the CLL cell still depends on other mechanisms of cell survival and DNA damage response, including through single-stranded DNA repair. And that repair is mostly led by these two proteins, ATR and also PARP. And so the rationale for using this combination is that RP-3500 is an ATR inhibitor and olaparib is a PARP inhibitor. And in solid tumors like breast cancer or colon cancer that have these major double-stranded DNA damage repair response pathways gone, the combination of these drugs, they have shown to be both synergistic and also highly active in solid tumors. So if they work in solid tumors, theoretically, they should also work in CLL. And so this trial is exciting because it is the first time that we're actually directly targeting these high-risk mutations and high-risk genetic changes in p53 and also ATM. We've really never been able to do this before, and so hopefully this combination will provide a new route of treatment for high-risk CLL patients.
So if I was a patient and I was interested in going on to this trial, what kind of testing would have to be done on me to see if I was appropriate for this trial?
Yeah, so the inclusion criteria requires that patients either have deletion 17p or deletion 11q. Typically, those changes in the chromosomes of the 17 and the 11th chromosome are tested through a CLL test called FISH that is pretty standard of care, and almost every laboratory will be able to do that testing. The other criteria include having specific gene mutations in any one of these genes, and these include TP53, ATM, SF3B1, XPO1, and POT1. And the majority of academic centers do usually have a gene panel that will test for these genetic changes within or genetic mutations in these 5 genes. However, there are also other more commercial laboratories like Tempus or Foundation One that your provider can send your CLL to get the testing done.
Sounds great. And I assume the trial is open currently. How many patients have currently enrolled to the trial, and how are they doing so far?
Yeah, so we've had 5 patients enroll so far. The trial is currently in the phase 1 portion, which means that we're trying to find a safe dose for both of these drugs in CLL patients. What we've really seen with the initial 5 patients is that the dose seems to be a little bit too high, in that it caused the CLL patients to have a decrease in their platelets and hemoglobin, to a point where some of these patients had to come off of the trial. Now, what we've recently amended the trial to is that patients would only actually take the combination of the drugs only 2 days per week instead of 3 days per week. There's actually a parallel trial in solid tumors with this combination with RP-3500 and also olaparib. In the combination, when it was given 2 days on and 5 days off per week, was much better tolerated and still showed some efficacy. So we are actually restarting the phase 1 portion with this new dose level of 2 days of dosing and then 5 days of rest every week.
And given that you've already enrolled 5 patients, do you have a good estimate about when this trial will be completed and when we can see initial results of how it worked?
Yeah, since we're restarting the phase 1 portion, I anticipate that the phase 1 will still take about a year. Probably until 2025. And then once we find a safe dose, this trial will lead into a phase 2 portion, which the phase 2 tries to determine the efficacy of the combination of the drug at whatever dose we determine to be the most safe. And so I think the phase 2, because it requires a lot more patients, will probably take about 2 years. So I do anticipate this trial will be still open for about 3 years.
Sounds great. So this sounds like an exciting new trial of 2 new drugs with 2 new mechanisms of action that hasn't been tested in CLL before that may be a good option for patients with high-risk CLL. Do you have any final thoughts that you'd like to share with our patients with CLL?
No, again, this will be, if this combination proves to be both safe and efficacious, it would be the first combination treatment to directly help these high-risk CLL patients and open up a new avenue of treatment for these high-risk CLL patients. So yeah, I agree with you that it's a very exciting trial.
That sounds wonderful. Well, thanks for coming, Dr. Hu, and thanks for talking about your new trial.
Yeah, thanks so much for having me today.